Hello and welcome to the Anxiety Disorders Association of British Columbia website and to this special section on childhood anxiety. I'm Dr. Michael Catchpole and my guest is Dr. Sarah Newth. Dr. Newth is a cognitive behavioral therapist with the North Shore Stress and Anxiety Clinic. Dr. Newth, thanks so much for being here.
It's great to be here, Dr. Catchpole.
Our topic is social anxiety disorder. Could you start off, please, by giving us a definition of what that is?
Well, kids with social anxiety disorder are excessively fearful about a whole bunch of different kinds of social or performance situations. They worry that they'll embarrass themselves or that people will think really badly of them.
How about some of the signs and symptoms, more specifically, of social anxiety disorder?
Well, these kids often have a lot of physical symptoms. So things like rapid heartbeat, trembling and shaking, blushing, upset stomachs, and as a result of that they may be really reluctant to enter feared situations, like not even going to school, not wanting to hang out with friends or even make friends. We know that kids who are older who have social anxiety disorder are at great risk for substance use problems, especially alcohol, if they discover that it disinhibits them. And kids of all ages may cope by not talking or maybe speaking only in a mumble or a whisper.
So if this is left unhelped or untreated, then the child is going to miss all kinds of developmental tasks that one needs to have in order to be an adult.
Yeah, like all of the anxiety disorders, if we don't help kids overcome them, they tend to remain chronic. We say that kids don't grow out of anxiety disorders, they grow into them.
Very interesting. Well, let's talk then about some home management strategies for social anxiety disorder.
Well, I think there's great reason for kids and parents to have hope for a better future, because with these strategies, they can conquer their social anxiety. As with all of the anxiety disorders, you want to help kids get educated. Teach them about anxiety, how it works, how it's normal, but theirs is simply excessive and overreacting.
Okay, and other things one can do?
Kids with social anxiety disorder are often really negative in their thinking. They tend to mind read and think that other people are thinking badly of them. They catastrophize any perceived imperfections in their behavior or their appearance. So help them come up with more realistic, calming thoughts that they can say to themselves to increase their confidence and lower their anxiety. Write those strategies down on sticky notes or cards that they can put in significant places as a reminder when they need them.
Is there a place for practicing or role-playing in terms of helping these kids?
Practice is huge, and what we want to do is identify the kinds of situations that are difficult, whether they're avoiding them or whether they're just tolerating those situations with a lot of discomfort. Rank them from least difficult to most difficult, and then set up a kind of fun, rewarding challenge for your child where they have a chance to practice, master that particular item on the list, reward and praise, and then move up to the next one.
So again, the underlying principle is exposure and increasing, sort of upping the ante, I guess. Is that right?
Yeah, and parents can really give their kids a head start by practicing these strategies at home first. Try a role play, especially for a child who needs some practice at key social skills. These kids often struggle with the basics, like making eye contact or smiling when you're talking to somebody. They may need to learn how to be assertive, how to say no, how to make conversation with another child or another adult. Role play at home can be a great way to kickstart these kids.
Dr. Newth, thank you for an excellent interview. Very, very practical tips for parents and caregivers.
It's been great to be here.
My guest has been Dr. Sarah Newth from the North Shore Stress and Anxiety Clinic.